A bit of health now. Wife of Katsina State Governor Fatima Diko Rada has joined a sensitization campaign on cervical cancer and prevention in the state. This initiative is aimed at teaching mothers the need for early screening, detection and prevention. TVC News correspondent Abdulatif Yusuf reports.
Ever since the demise of my beloved mother to cancer,
many women may have to live the rest of their lives with the pains afflicted of losing one dearest to them to cervical cancer or still struggling for treatment. Cervical cancer is the second most frequent causes of cancer deaths among women. Records in Nigeria also shows about 12,000 new cases and 8,000 deaths as at October last year. The wife of Katsina State Governor, in collaboration with the State Ministry of Health and the State Primary Health Care Agency, is engaging stakeholders on new methods to prevent cervical cancer.
This is not just about war against cancer. It's about you and I. It's about service to humanity. It's about taking a stand and making efforts for the victims. It's about giving hope for the hopeless and caring for them where care is all that is left. For every time I think about cancer victims, I can't help but imagine them suffering from the aftermath of chemo and radiotherapy sessions.
Lack of sensitization campaigns and regular health talks on deadly diseases like this has always led women to health complications. This is why the Ministry of Health is now determined to reduce the number of new cases through rigorous sensitization campaigns.
One of the key strategies for reducing the burden of cervical cancer is through awareness and prevention. This includes educating women about the importance of regular screening and early detection. We also need to ensure that women have access to quality and affordable treatment.
The new initiative on cervical cancer awareness intends to complement government efforts by sourcing more funds to finance awareness and proper education on cervical cancer. It was also an opportunity for the professionals, victims and their families to interact of reaching cogent solutions to address the increasing cases of cervical cancer. Abdulatif Yusuf, TVC News, Katsina.
Public health physician Dr. Miriam Oshodi joins me on the news to talk more on awareness for cervical cancer. Dr. Oshodi, thank you for your time. The theme for this year's observance is Learn, Prevent, Screen. Perhaps you want to speak to us about what you think the main risk factors are for cervical cancer that everyone should know about.
Okay, thank you very much. Good afternoon, everyone. So like you said, the theme for this year's is Learn, Prevent, and Screen. And major risk factors for cervical cancer have been found out to be smoking, young age of first pregnancy, presence of females that have other sexually transmitted diseases that have not been treated, also people with poor immune status, and then also long use of contraceptives, or hormonal-based contraceptives, and then multiple sexual partners as it is made. Now, for cervical cancer, like you rightly said, the theme for 2024 is Learn, Prevent, and Screen. And this is because it's been found out that in cervical cancer cases, it's been caused by human papillomavirus in 99% of cases. And cervical cancer is the fourth most common cancer in women, with an estimated number of 604 cases, new cases in 2020, and 342 cases in 20 deaths, I beg your pardon, in 2020. In Nigeria, as of October last year, there was an estimated number of 12,000 new cases and 8,000 deaths. And what this simply means is that there's poor detection of females with cervical cancer. Women with cervical cancer, some of the symptoms and signs that they might see include unusual bleeding. So if you're a woman and you're not, aside from your regular menstrual cycle, you're having bleeds, whether you're menopausal, so you're having postmenopausal bleeds, or bleeds after sexual interaction with your partner, you need to actually go to the hospital and check that out. Also, females can also have foul-smelling vaginal discharges, weight loss, leg swelling, persistent back pain, vaginal discomfort, as the case may be. However, for cervical cancer, what is the key? Just like the team said, learn, prevent, and screen. The first thing is public awareness. So like we're saying, we're having this discussion, the discussion needs to come up more often. So we need to enlighten everyone, all females, mothers, sisters, women, basically, that they need to know about cervical cancer. They need to know signs and symptoms that they might be seeing, so that they will be able to check early enough.
You know, with cancer, they say early detection is key. How accessible is screening, you know, for people to check, and how often do you think that should happen?
Okay, so going to the next team, which prevents, I'll come back to that, but screening, which is the third. So for screening, it's important that females aged 29, once you're above 30 years old, you need to check for, you need to have a cervical cancer screening. And we usually call that the pap smear, Papa-Nicolau smear, as famous. So for females that do not have family history of cervical cancer or any form of cancer, you should check every 3 years. So you go for your check this year, whatever investigation results you have, the doctor or healthcare professional will advise as appropriate. And if everything is fine, you go for another check in another 3 years. Now, for females that have family history of cervical cancer or any other form of cancers, they may need to increase their number of checks. However, apart from the pap smear, there is a less expensive, so that is the VIA, that's the visual inspection with the acetic acid. And that is readily available in most of the facilities. It's just a visualization of the cervix. The cervix is the lower part of the womb, of the uterus of the woman. And so that is also done. And then most of the secondary facilities have the ability to carry out VIA, and also some of the primary healthcare facilities across the country. So that should not be a problem. However, for the Papa-Nicolau smear, yes, you might need to go to the tertiary facility or other specialized centers where you'll be able to have the pap smear done. Indeed. Because there'll be some precautions that'll be given to you, some instructions that'll be given to you before you can have the test carried out.
So how can this be prevented? Because, you know, on one hand, it's screening to check if you have it or not, but is there what everyone can do to prevent having cervical cancer?
Yes, so that's the second theme for 2020 of cervical cancer prevention. So to prevent cervical cancer, the first step is there is the HPV vaccination. Now, the HPV vaccination is given to girls between the age of 9 to 14 years, and that is before the age of sexual activity. That is prevent them from cervical cancer. And this because for anyone that has cervical cancer, the person will have had an underlying human papilloma virus infection. Now, this infection, depending on the immunity of the woman, can go away on its own. However, infection can also be persistent and reoccur and then come up with cervical cancer 15 to 20 years time. So it's important that for females 9 to 14 years, you get vaccinated. Now, Nigeria as a country rolled out the first phase of HPV vaccination exercise in 16 states in the country, Lagos inclusive. So girls 8 to 14 years, the late primary sessions and the junior secondary and early senior secondary girls have been given the vaccines. It's available in all primary healthcare facilities in those 16 states, Lagos inclusive. And then the second phase is going to be rolled out by May 2024 in Nigeria. So it's going to be available in all states in the country. And it's also been incorporated into the national immunization scheme for the country. So girls aged 9 years to 14 years are able to get the vaccine free of charge in the country. And so that's one very important step to preventing cervical cancer. The next step is early detection. So we need to improve our health-seeking behavior, because it's key that if you notice any of the signs and symptoms I had mentioned earlier, you go to the healthcare facility and ensure that you get screened to be sure that, yes, it's not cervical cancer. Because cervical cancer is very treatable. The most important thing is to ensure that it is detected on time.
All right.
But unfortunately,
I'm afraid that's our time, Dr. Oshodi. We'll find more time subsequently to talk more about this. Public health physician, Dr. Miriam Oshodi, thank you so much for sharing your thoughts with us.
Thank you. Thank you.